Today I'm talking about what I learned from Chapter 10 regarding the legal and ethical rules in mental health care. Ethics is basically the study of what is right and what is wrong. The book explained two main ideas: anonymity and beneficence. Anonymity is a person's right to make their own choices, like where they live or what they do. Beneficence is our job to do what is best for the patient's health and safety. Most of the time, we want to respect a person's choices, but sometimes if someone is in a crisis, their choices might put them in danger. That's when these two ideas clash. Think of it like a scale. On one side, we have the patient's freedom. On the other, we have their safety. If a patient is healthy, the scale tips forward towards freedom. But if they are in a mental health crisis, the scale tips towards safety. Our goal is to always treat people with dignity and respect their patient rights, which means they should always be in a safe, clean space and be treated with kindness no matter what they're going through. One big thing the book teaches is that having a mental health issue doesn't mean you lose your rights as a citizen. Patients have a right to treatment, which means the facility has to actually help them get better, not just give them a bed. They also have the right to refuse. This means even if a doctor thinks a certain medicine is a good idea, the patient can usually say no. This is where informed consent comes in. We have to explain the treatment in simple words: what it does, the good parts, the bad side effects, and what happens if they don't take it. We usually just tell them what to do. We ask them to be a partner. If a patient feels like they have a choice, they are much more likely to trust the staff and actually get better. It's about making sure the patient is part of the team, not just a number in the bed. Next, the book explains how people get admitted to a hospital voluntarily admission, which is when someone asks for help themselves. But sometimes someone is in so much trouble that they have to be admitted even if they don't want to. That's what involuntary commitment is. As you can see in the middle of the chart, there are three main reasons this happens. One, they might hurt themselves. That's danger to self. Two, they might hurt somebody else, which is danger to others. And three, they are so confused or sick, they cannot take care of their basic needs, which is gravely disabled. Gravely disabled is a term people often get confused about. It doesn't mean someone is just acting weird. It means they are so sick they cannot find food, or they might walk into traffic because they don't realize it's dangerous. We have to be very careful with this because we are taking away someone's freedom. So the book says we must have clear written proof of these behaviors before we can keep someone against their will. Privacy is a huge deal in healthcare. Protected by a law called HIPAA, usually what a patient tells a provider is a secret. But there is one big exception called the duty to warn. This rule comes from a famous court case called Trezorov. The story behind this is important. A long time ago, a student told his therapist he wanted to hurt someone. The therapist kept it a secret because of privacy rules, and the person ended up getting hurt. Because of that, the law changed. Now, if a person makes a serious threat to hurt a specific person, the healthcare team cannot keep that a secret. We have a legal duty to protect the person in danger. That might mean calling the police or calling the person who was threatened to warn them. Keeping people safe from violence is often the top priority, even over privacy. The last part of the chapter covers seclusion and restraint. Seclusion is putting someone in a safe room by themselves, and restraint are tools used to keep someone from moving their arms or legs. The book is very clear. These are last resorts. We only use these if we have tried everything else first. This means we try talking to them, we try giving them a quiet space, we try offering medication. If they are still trying to hurt someone, then we use restraints. But there are very strict rules. A staff member must stay with the patient the entire time to make sure they can breathe and stay calm. We have to check their circulation and give them water or bathroom breaks every 15 to 30 minutes. If we don't follow these rules, it is against the law. The goal is always to get the restraints off as soon as the person is calm and safe again. Thank you for listening.